Guillain-Barré syndrome, or GBS, is a rare disorder where the body's immune system mistakenly attacks the peripheral nervous system. This system is like a network of wires carrying signals from the brain and spinal cord to the muscles. When these signals are disrupted, it leads to symptoms like weakness and tingling in the extremities. GBS often emerges following a bacterial or viral infection. The immune system mistakenly targets the myelin sheath of nerve fibers, disrupting nerve impulses. This can be triggered by infections like Campylobacter jejuni, influenza, or Zika virus. Symptoms typically begin with a tingling sensation in the toes and fingers. This tingling often progresses to muscle weakness, affecting both sides of the body. As the condition advances, it can lead to difficulty walking, speaking, and even breathing. The progression of GBS varies from person to person. Some individuals experience a rapid onset of symptoms, reaching peak severity within a few days, while others may see a more gradual progression over several weeks. Regardless of the pace, GBS is considered a medical emergency, requiring immediate attention and care. Diagnosing GBS involves a combination of assessing the clinical presentation, reviewing the patient's medical history, and conducting specific tests. A key diagnostic tool is a lumbar puncture, also known as a spinal tap. This procedure involves collecting a sample of cerebrospinal fluid, or CSF, the fluid that surrounds the brain and spinal cord, to analyze for telltale signs of inflammation and specific proteins indicative of GBS. Another test is electromyography, or EMG, which measures the electrical activity of muscles and nerves, helping to identify any abnormalities in nerve conduction. While there is no cure for GBS, there are effective treatments available that can significantly improve symptoms, shorten the duration of the illness, and reduce the risk of long-term complications. These treatments aim to suppress the immune system's attack on the peripheral nerves, allowing the nerves time to heal and regain function. One common treatment approach is intravenous immunoglobulin, or IVIG, which involves administering high doses of antibodies purified from healthy donors. These antibodies help to neutralize the harmful antibodies attacking the nerves. Another treatment option is plasma exchange, or plasmapheresis, a procedure that involves removing the liquid portion of the blood, which contains the harmful antibodies, and replacing it with healthy plasma from a donor. The recovery process for GBS can be lengthy and challenging, often taking weeks, months, or even years. The good news is that with appropriate treatment and rehabilitation, most individuals experience significant improvement and can regain much of their lost function. Rehabilitation plays a crucial role in the recovery process, focusing on physical therapy to improve muscle strength and coordination, occupational therapy to regain independence in daily activities, and speech therapy if speech or swallowing difficulties arise. While anyone can develop GBS, certain factors can increase the risk. These include age, with older adults being more susceptible, and recent infections, particularly those caused by Campylobacter jejuni and influenza. Having certain autoimmune disorders or a family history of GBS may also elevate the risk. GBS can lead to serious complications if not diagnosed and treated promptly. One major complication is respiratory failure, which may require mechanical ventilation. Other complications include blood clots and chronic pain. Prevention is challenging, but good hygiene and vaccinations can help. If sudden weakness or neurological symptoms occur, seek immediate medical attention. Early diagnosis and treatment are essential for improving outcomes.